So at this point, I'm including emergency service programs, often referred to as crisis services. They are not a level of care, but interaction with them is necessary to access the following levels of care that I'm going to talk about. So we think it's important to know about them. So emergency service programs, ESPs, are 24/7 assessment programming for individuals who are experiencing a mental health or psychiatric emergency or crisis. The term crisis, I think, can be really subjective. And having done this work, it's really important that we expand our definition of crisis and not be narrow in defining it and what that might look like for someone. Having said that, individuals who often seek out crisis services or end up being seen by a crisis team do so typically because they're having suicidal thoughts. Maybe they've taken some actions or made a suicide attempt. So, this service is really reserved for people who are experiencing mental health symptoms that are impairing their ability to stay safe, whether that's intentional or not. So we may see major disruptions in caring for oneself, not taking, medications, not addressing medical conditions that then could be life-threatening or life-altering, engaging in substance use that also impacts safety. So someone might not be at risk because of their intentional actions, but they're so impacted by their mental health symptoms that they're unsafe in other ways. So typically that's what's going on when someone, whether it's the individual themselves, a family member, a provider, reaches out to crisis services. I really like to frame it for people because crisis sounds really overwhelming and not super strengths kind of rooted. So I like to say that, a person needs crisis services when their needs or challenges are exceeding their strengths in any given moment, or the strengths of their systems, right? So a lot of times as caregivers, we're providing the support, but it's overwhelming to us as well. And so when that happens, there's this imbalance that creates a dynamic that a crisis may occur, that something, more significant, more imminent, and more unsafe may occur. So ESPs typically are needed to access the levels of care that I will talk about, but that doesn't mean to utilize them, you have to exactly be at that point. They're also a resource for people. They can help with outpatient referrals. You can call and say, I'm looking for an outpatient provider. They can help with connecting you with these in-between services, the IOPs and the partial hospitalizations. And they're also there as support. Many have hotlines. Many can walk you through kind of navigating these different processes. So typically used in emergency situations, but you don't have to wait for that time to reach out to them.